Okay, we're going to be talking about hidden causes of atrial fibrillation, and why everybody's scared of AFib is you can form a clot in the left atrial appendage and toss it up to the brain, have a big stroke. Okay, it markedly increases the risk of stroke. Big risk factors for stroke are AFib, hypertension, diabetes. Okay, we're going to also talk a little bit about the role of mitochondrial dysfunction in AFib, and I got some surprises. I don't care who you are. I got stuff in here I guarantee you don't know. All right, there's going to be some surprises today. So here's the first, a little comic relief. Recurrent atrial fibrillation associated with monosodium glutamate. So there's a lot of BS going around that MSG is safe. Safe compared to what? And people will try to compare it to dietary salt and say dietary salt is worse. Yeah, right. The Japanese back in the 1960s were eating 12 to 14 grams a day of salt. You know, and that's not a smart thing to do. They had a lot of hypertension. They had a lot of intracranial strokes, but they still lived pretty long. It's because they ate primarily plants besides their cigarette smoking and their high sodium. There's other things funny about it. It can cause insomnia. It can cause headaches, migraines. And here I got some, and it's a neurotoxin. It's an excitotoxin, okay? Increases your risk of neuronal injury, okay? But it gets better. It gets better. So here is MSG associations with male reproductive dysfunction. And that's what I think is funny is it's almost as if processed food is designed to sterilize you, okay? The atrazine, it's the one that turns the male frogs into females, and it's a mitochondrial inhibitor. Isn't that wonderful? Glyphosate also is an endocrine disruptor, and it's a mitochondrial inhibitor, and it causes leaky gut. And here's MSG. It's a brain toxin to make you stupid, and it also feminizes you. Isn't that great? You know. All right, comic relief. Oh, just here's the illustration from that paper on MSG, you know, talking about how it decreases testicular function, okay? It impairs erectile function. It decreases sperm quality. This is MSG, monosodium glutamate, and I would guess that manufactured-free glutamate, MFG, does the same thing. Decreases the size of the testicles. Great. Can cause testicular cell apoptosis, cell death of testicular cells. Great. And a lot of people feed that to their kids because they don't even know what they're doing. Okay, here's some other wonderful news about, you know, you hear a lot of people trying to tell you, oh, you should be taking omega-3 supplements. Yeah, right. They're associated with, you know, they're obesogenic. They're liquid fat. They're oils. They're at risk for lipid peroxidation, but it gets better than that. Omega-3 supplementation linked with atrial fibrillation. Okay, so how is something that's going to increase your risk of atrial fibrillation, increase your risk of prostate cancer, increase your risk of obesity, how is that going to protect you from cognitive decline? Yeah, right. Okay, here's another paper on omega-3 fatty acids and atrial fibrillation. Let's see, you know, higher incidence of AFib in the people taking the omega-3 supplements. I thought that was funny. Okay, here then also, you know, you hear all this BS about psychiatry not being a joke. No, psychiatry is a joke, and you should know that. Association of depression, antidepressants with AFib. They increase your risk of AFib. Antidepressants, they not only will give you a lobotomy, they can also give you afibrillation. Association of antidepressants with atrial fibrillation and ventricular arrhythmias. Great! Okay, what's this one? Antidepressants were associated with an increased risk of atrial fibrillation. Here are, based on our investigations, use of antidepressants are closely related to an increase in AFib risk. Okay, here's just some papers showing fluoxetine in mitochondria. Fluoxetine, that's Prozac, it's toxic to your mitochondria, triggering apoptosis and or altering, apoptosis is cell death, and altering mitochondrial function. Isn't that great? And this is just all antidepressants inhibited complexes 1 and 4. So this is 1, 2, you know, several antidepressants. That's terrible. That's like the worst thing I would think a drug would do. One of the worst things a drug could do is inhibit your mitochondrial function, okay? Okay, now we're going to have to talk a little bit about leaky gut, and this will also be interesting because it gets into some stuff that's not widely known. So the basic thing to protect you from leaky gut, you eat dietary fiber, the smiley face good bacteria, they make butyrate. Butyrate is used by the gut lining cells, the enterocytes, to make tight junctions so your gut is secure. Bad things can't get across. Leaky gut means increased intestinal permeability. All of these chemicals here are toxic to the gut wall, which includes oils, alcohol, tap water from the fluoride and the aluminum, okay, emulsifiers in processed food, alcohol, NSAIDs, aspirin, the PPI, it leads to problems with your gut wall. Birth control pills can lead to problems with candida infections and gut wall problems. Radiation therapy to the gut, chemotherapy to the gut, traumatic brain injury. You get blood-brain barrier leakage. You also get gut leakage, increased gut permeability. Corticosteroid medications, titanium dioxide. It's in a lot of pills and stuff, and in some toothpastes and other things. Okay, so anyways, when you get leaky gut, what happens? You lack the tight junctions, so bacterial endotoxins like LPS from gram-negative bacteria, LTA from gram-positive bacteria. LPS is lipopolysaccharide, LTA is lipoteichoic acid. They can get across the gut wall and get into the blood, and they make the blood more prothrombotic. That's a big deal, okay? That, I think, is one of the major hidden secret causes why people are so sick. Okay, so here's showing just a picture of what happens. You know, you got your gut here, and when you get leaky gut, these LPS toxins get into your blood and LTA. It also occurs with free iron and free iron overload. We're going to come to that a little later in this talk. So what happens is your clotting protein, your fibrinogen, are shaped like a cylinder, okay? And that's called alpha helix, secondary protein structure. And in the context, when they contact LPS, LTA, or free iron, they change the beta pleated sheet and they stack like a deck of cards. The bigger, and they form hydrogen bonds in between the different individual molecules. The larger the molecular weight of a molecule in aqueous solution in water, the human body, the more likely it is to precipitate. To precipitate in blood is to clot. So you form these clots. And when you undergo secondary protein structure transformation from alpha helix to beta pleated sheet, that's called an amyloid transformation. So these are amyloid clots. They also are sometimes called fibrinolyte clots. Well, anyways, amyloid clotting is bad. It's very refractory to lysis, meaning it's harder to dissolve these clots. They can be anywhere typically sizes 2 to 200 microns, which is big. Typical capillary is about 5 microns, so they can plug up little capillaries, little arterioles in your body. You don't want that. Okay, these two researchers did a fantastic job. They deserve a Nobel Prize, but they'll never get it because big corporations don't want people to know about this. So this is Etheresia Pretorius from South Africa. They're both PhDs. Douglas Kell from England, okay? And they're the ones that did most of the work to figure this out. Normal red blood cell, kind of discoid, little indentation in the center. Normal clot with thrombin, for example, it forms like little pieces of spaghetti-like material that'll encase the clot, like a spider web of spaghetti, if you will. But when you've got elevated amyloid clotting due to leaky gut with LPS, LTA, or excess free iron, it'll form what they call dense matted deposits, very irregular clots, very difficult to lyse, meaning very difficult to dissolve. They're more refractory. They're more likely to plug up an artery and not be able to reopen that artery. So they're worse than a regular clot. Okay, this is one of their papers here by Douglas Kell and Etheresia Pretorius, fibrinolyte microclots and atrial fibrillation, okay? And just again showing an irregular clot here encasing this red blood cell rather than the spaghetti-like pieces of dense matted deposit. Other things that can form these also include viral proteins, okay? And I think a lot of people have had problems with that. So there's a lot of things that can form these, okay? And also excessive estrogen excessive estradiol, okay? 17-hydroxyestradiol. And who knows if some of these other estrogen chemicals might have similar effects. I don't think you want to be estrogen overloaded. I would avoid all that stuff. That soy is sprayed with glyphosate, toxic stuff. Soy is off the charts in estrogen. I'm not a big fan of flax, really estrogenic. You can have goitrogenic antithyroid properties from these things. I don't like it. I don't like things that feminize and make me fat. Okay, even though, you know, there's sort of like this party line trying to tell people it's normal to be fat and feminized to men. I don't think so. Okay, this is just an illustration from their paper to the same effect. Kind of a lousy illustration, but, you know, they're trying. That's Kell and Pretorius. Here's just some more of the things we talked about. This is from, again, the paper by Kell and Pretorius. The size range of the amyloid clots, 2 to 200 microns. Comparatively resistant to normal processes of fibrinolysis. That means clot dissolving. Some are even resistant to dissolving to trypsin, a strong protease. Okay, that means they're very resistant. And they can be induced by LPS, LTA, estradiol, the female hormone. In English, they call it O-estradiol. They stick that O in there. And also by a viral protein. Okay, you can get them from having problems with your poor dentition. Okay, periodontitis. That can allow bacteria to get into your blood, bacterial endotoxins, just like leaky gut can, okay? and you eat a bad diet. High-sat food diet, omega-6 cooking oils are all associated with a lot of leaky gut. Not good. Okay, more causes of atrial fibrillation. Lack of magnesium. You can treat AFib and get the rate under control quite often by giving intravenous magnesium. And a lot of people are magnesium deficient. The most common nutrient deficiencies in the USA are the things from plants. Magnesium deficiency, potassium deficiency, fiber deficiency. Okay, here's another paper, intravenous magnesium used successfully for treatment of atrial fibrillation, especially if the potassium serum levels are below 3.5. It's harder to accurately measure magnesium levels, but if you go to the effort to it, you see that a lot of people are low in magnesium. Also ferritin. So ferritin's an indicator roughly of excess free iron if your ferritin levels are quite high. I like to try to get mine low. The papers will tell you you're normal if you're below whatever, in the 200s or so, but I want mine real low. I like mine, 25 to 80, 30 to 80, let's call it. If you get below 25, you can get restless leg syndromes or have some other problems, and it's hard to get it down low. Every time I give blood, like I go for blood tests, I just tell them pull off a couple extra tubes. Okay, so here's some papers saying high dietary intake of iron associated with atrial fibrillation, elevated serum ferritin associated with atrial fibrillation. And then I had a bunch of papers on LPS, gut-derived serum LPS, lipopolysaccharide associated with increased risk of MACE. MACE means major adverse cardiac events and atrial fibrillation. Impaired fibrinolysis with atrial fibrillation and elevated LPS. So you can measure LPS levels in the blood. And when they're elevated, that means you're increased likely to have refractory clots you can't dissolve. So I'm just saying what I said earlier, but showing it with a paper. So I want you to see this is real. This is actually well published in the medical literature, but no one knows about this. I've never met a single doctor who knows this stuff, by the way, just so you know. Serum LPS. And the reason is doctors read the book they have to read to pass their boards, and then most of them don't read much after that. It's rare to encounter a doctor who actually reads on their own other than for their boards exam. Okay, serum LPS is associated with recurrence of AFib after radiofrequency ablation. Okay, so if your LPS is up, you're more likely to get recurrent AFib. So it's kind of stupid to go for an ablation but not fix your diet or fix your other risk factors for leaky gut, because you're just going to have a high risk of recurrence. So you're going to let somebody burn a hole in your heart and then not do your share of the job to make sure you're low risk for a recurrence. Okay, our results indicated circulating LPS was a predictor of recurrent atrial fibrillation. Okay, you don't want that. Also, if you got elevated TMAO, that's what you get elevated, trimethylamine oxide, if you eat, meat diet, animal protein, okay, animal food. Okay, so you don't want to be eating animal food at all. Okay, and here's just one showing estrogen is prothrombotic. It has been well established that estrogen increases the risk of both arterial and venous thrombosis, venous clotting. While estrogen is known to induce prothrombotic milieu, the mechanism is not known. Well, Pretorius and Kell, they showed that one of the things it does is it increases amyloid clotting. It'll increase a woman's risk of DVT if she's taking birth control pills. Okay, and one risk, not that many women with birth control pills get this, but if you start superimposing multiple risk factors, sedentary, long travel ride, birth control pills, and some of these other things, high-fat diets, you're making yourself prothrombotic, okay? And you can increase risk of unusual site thrombosis, including arterial thrombosis, okay, from elevated estrogen levels. Women's estrogen levels are high when she's pregnant, it's a fat storage hormone, save that fat for the baby, but it's also prothrombotic. This lady wrote a really good paper here. Her name is Bianca Brundell, about the role of mitochondrial dysfunction in atrial fibrillation. And as you know, good quote from Roger Seahold at MedCram. He said, when mitochondria don't work, nothing works. Good quote. Nick Lane, the most important thing you could do to age well and optimize your health is maintain good function in your mitochondria. I just gave a lecture yesterday, Vincent Mitochondria. I went over the whole a new sort of modified version of the mitochondrial theory of aging to make sense of it. Okay, we're not going to go into all that paper right now. I've gone over it before, and I'm going to go over it again in the future. But one of the things I did is, people who know me have heard me say this before, but there was nothing in the medical school, the college level textbooks of biochemistry on mitochondrial dysfunction and mitochondrial inhibitors. So, and I couldn't find it in my nutrition biochemistry books. I own a whole bunch of biochemistry books. So I had to go through all the medical literature, and I quickly found 10, 20, 30, 40, 50, 60, 70 of them, and they're really common. We just talked about serotonin selective reuptake inhibitors, antidepressant medications, tricyclic antidepressants, antipsychotics like hell. Like I said, all psych drugs are a joke. They cause a slow lobotomy, in the words of Peter Bregan, the greatest psychiatrist who ever lived. In the case of antipsychotics, it can be a fast lobotomy. Fluoride does it, hydroxynonenal from omega-6 cocaine oils. Okay, there's tons of them. Tylenol, statins, metformin. These are all mitochondrial inhibitors with the potential to cause cardiac muscle dysfunction. Not good. Not good. And that's why I say, you're robbing Peter to pay Paul if you think you're going to fix your problems, treating your diabetes and high cholesterol with a statin and metformin. Why not just go low-fat vegan? So you're not ingesting anything that inhibits your mitochondrial electron transport. Stupid. Okay, and just, gateway diseases, hypertension and diabetes produce atherosclerosis, diabetes thickening your capillary basement membrane, hypertension causing hypertrophy and hyperplasia of your vascular smooth muscle cells, decreasing the amount of oxygen delivered to your tissues, progressively raising your blood pressure, injuring your arterial walls, producing more atherosclerosis, which is going to lead to less oxygen delivered to your tissues, your muscles, your brain, your heart. It's all bad. Okay, what else we got here? Oh, aluminum causes leaky gut, okay, and that's going to, give you increased LTA and LPS, endotoxins getting in there. Here's just an illustration showing ways that aluminum damages your gut. We know that sat fat is associated with leaky gut and, multiple sclerosis, autoimmune disease, animal foods. I just want to show you a little bit about iron metabolism. Iron metabolism should be taught to everybody, but medical students don't learn it. I've never in my life met anybody that knows iron metabolism. Douglas Kellogg, again, athyresia pretorius, did Nobel Prize work on iron metabolism. But lots of people have been writing about iron metabolism for a long time. Okay, there's tons of books. I read all these books on iron metabolism. This guy's a really great teacher. This guy, Vernon Louvre. Okay, this stuff is well known. It's been published in books for decades. Okay. All right, here's just one more paper by Douglas Kellogg and athyresia pretorius. They are able to show amyloid clot formation from LPS bacterial endotoxin, from LTA bacterial endotoxin, and from iron, excess free iron. Okay, so excess free iron is pretty toxic stuff. It's been described by this one iron scientist, Ed Weinberg. He said, iron's like a fire. It's good to have where you need it, like in the stove, in the furnace of your house, but you don't want it anywhere else. It burns stuff down. Okay, this painting is Burning City by Egbert van der Pol, beautiful, from the 1600s. Okay, so here's the deal with iron. When you have excess free iron, it starts to ferrous redox cycle between Fe3 plus, Fe2 plus, Fe3 plus, Fe2 plus, giving off electrons, and it can give off electrons to the Fenton reaction. Fenton reaction is easy to remember. Fe for ferrous, like iron, Fe for Fenton, ferrous like rust, Latin word. Okay, Fe for Fenton. So you give off an electron and it makes hydroxyl radicals that can damage tissue. Lipid peroxidation, can damage DNA, can cause all kinds of problems, and that reaction can happen in mitochondria. Okay, so you don't want free iron. Iron's a transitional metal, has a variable valence, and it's popular in enzyme active sites because it can hand off electrons. It's convenient in hemoglobin to bind to oxygen because it can hand off electrons. So it can do unique things that make it useful where you need it. But it is not good to have it running around free where it can just sort of catalyze harmful reactions. So here it is in hemoglobin, for the bonding to the oxygen and allowing the release of oxygen. Okay, magnesium is found in the center of chlorophyll. So once again, the good thing, you get it from eating the plant, magnesium in the center of chlorophyll. The bad thing, the excess iron, most Americans are iron overloaded. The men after 25 years of age, the women, when they're postmenopausal by 60 years of age. Okay, and here's just, showing the diagram here. Men get iron overloaded pretty fast in their 20s because in the Western countries, they eat a lot of meat and the processed food is fortified with iron. Again, they put stuff in it to hurt you. The magnesium, the MSG is bad for you in processed food. The glyphosate on the soy that uses protein is bad for you. The mercury that's in the high fructose corn syrup is bad for you. The atrazine sprayed on the corn, it's bad for you. The iron that's added to so-called fortify is like to poison it. That's bad for you, okay? Women don't tend to get iron overloaded until after menopause once they stop menstruating. This is why you don't want to eat processed foods, just more and more reasons. And the point being, when you get free iron in the... normally you want to store your iron on ferritin. And your body stores some iron in case we bleed, get scratched by a tiger. We can replenish our hemoglobin fast, okay? But when you start getting overloaded amounts of it, it starts becoming free, unbound to ferritin, intracellular or transferrin in the blood. And then it can start catalyzing these Fenton reactions and causing free radicals with increase in oxidative stress and destruction of tissues. You don't want that. Okay, this is just one more picture from the Kellum Pretorius paper, again showing iron forming these dense matted deposits rather than these more simple spaghetti-like clots. Okay. All right, so we went through a whole bunch of things causing atrial fibrillation. What are a couple quick points? When you want to get healthy, you got to stop doing all the bad stuff. You don't drink less alcohol. You stop drinking alcohol. Because I just see these people who half-ass it. They don't do that well. The ones who go all the way, I don't drink alcohol anymore. I don't drink caffeine anymore. You know, they have the best possible outcomes. They do the best. Okay, and you want to get your AFib under control because the longer you have AFib, the less likely you are to ever reverse it. You know, classic risk factors, you know, increase with aging, kidney failure, diabetes, hypertension, obstructive sleep apnea, obesity, estrogen overloaded. We talked about leaky gut, being iron overloaded. Ischemia, just atherosclerosis, COPD, obstructive sleep apnea, stressed out, working the night shift, sleep deprived. All those things are kind of the same thing. Caffeine, amphetamines, sleep deprivation, psychological stress, excess, working the night shift. It's going to end up depriving you sleep. If you're hyperthyroid, that can do it as well. Mitochondrial inhibitors can cause it as well. Circuit inhibitors, which have a similar effect to mitochondrial inhibitors. Things that smell bad, you know, flame retardants, paints, glues. Anyways, these are a lot of things that cause AFib. That might be it. Let's see if I got any more slides. So sort of the same thing. Anyways, I hope that was helpful. Some insight on additional hidden causes of atrial fibrillation that are relatively easy for you to avoid. Now you know about them. Hope that was helpful.